And so today we're going to focus on the Center for Global Health. And I'll turn it over to you, Anna.
Great. Thanks, Natasha, for inviting me and happy to be here with all of you. My name is Anna Kalbarczyk. I am the Assistant Director of the Johns Hopkins Center for Global Health. I'm also an alum of the DRPH program, so can certainly also speak to any questions you might have about the program as you're going through it. But today, here to talk a little bit about the Center for Global Health, what we do. And then I'd really love to have this also be a listening session where I can capture your thoughts on what the center might be able to do to serve the DRPH community better. But before I get started, or as I'm getting started, maybe I could also ask each of you to introduce yourselves briefly in the chat. Just let me know what your interest in global health is, particularly as it relates to your time in the DRPH. So that could be about your current job or the dissertation work that you'd like to do. Maybe it's specific to maternal and child health or HIV, health systems, or a country of interest. But throw it in the chat and just let me know a little bit about who we are. And if I don't see the chat going, then I'll just start asking folks to speak up. Natasha knows I'll do it. I will do it. My own personal global health interests are really in women's health and gender equity. I'm an implementation scientist by training, so I conducted my DRPH work in the implementation science concentration here at Hopkins, but really use those two lenses, both implementation science and gender equity, across a range of health issues. I think of myself as a bit of a Jill of all trades, but also it means I just don't like to focus on a single issue. And I think these two things can be applied across a range of health challenges. So great. Thank you for getting us started. I see we've got some interest in SRHR, climate change, and cervical cancer, human trafficking, women's health, and impacts on global health. We've got someone from the Global Health Concentration here, planning proposal around cancer screening guidelines. That's great. And interested in health systems and maternal and child health, neglected tropical diseases. Okay, race and class stratification and how humanitarian aid is delivered. Vector-borne diseases. Excellent. Okay. Good. So quite a range of issues, which I think also reflects a lot of the range of work that our faculty across the School of Public Health, but also the university more broadly are interested in and doing work on, which is also important for you as you start to think through your capstone opportunities, your dissertation, uh, advisors and your team, the people who will really be focused, your reviewers on your dissertation. And that's one of the services that we can provide, is helping you find global health faculty across the university. So great, keep it coming. If you haven't added your global health interests in the chat, please do put them in as we talk. My presentation will be brief, but I hope the discussion will be robust. So the Center for Global Health is really a facilitating center. So we strive to facilitate and focus the expertise and resources of Hopkins, all of the Hopkins institutions. So not just the School of Public Health, but also the School of Medicine, Nursing, Education, Engineering, KSAS, Business, to work together with our global health collaborators to address the world's most pressing health issues. So we see ourselves as a convening center, bringing people across the university together to enhance interdisciplinary work and to enhance our ability to basically get really large funding in order to tackle really challenging problems. We are a really small core team at Hopkins, so many centers might be vast with lots of staff and faculty, but because we have a Department of International Health at the School of Public Health, the Center for Global Health isn't really so much made up of faculty in terms of faculty research conducting through the Center for Global Health, but more a small core staff that works on select issues or select programs that we run. Historically, we've had faculty grant programs and scholarship programs, but as our funding has decreased over the years, we've really focused our work on student-centered programming. And so that has included global health grants, like our Global Health Established Field Placements and our Field Research Awards. Um, Doing select workshops on issues as they emerge or as people ask us to help facilitate, especially if we're trying to bring across expertise from across the university. As I mentioned, historically, we have offered scholarships, although that is no longer within our programmatic repertoire, and experiential learning opportunities. As I said on the last slide, we really provide a nexus for interdisciplinary collaboration and really try to bring together people to succeed with large global health grant proposal submissions. Although, as I'm sure all of you can imagine or understand, given your global health interests and experiences, this has been a dwindling field as well. So it's been a very challenging year to be a coordinating center within the global health space. We also have a lens that really focuses on global health leadership, and we do this in a few ways. So we support there's a Fogarty consortium that Hopkins is a part of called UJMT. The lead institution is University of North Carolina. And we run the Research Leadership Academy with that Fogarty Institute, which really focuses on enhancing leadership skills while people are in the field conducting research. We also have the Emerging Women Leaders in Global Health, or EDGE initiative. And this is really focused on, I would say, women's leadership historically, but really more gender transformative leadership. So rethinking the way that we conceptualize and consider leadership within the global health space. This is one of our most active programs. We have a Slack network, a regular newsletter. We host regular events in collaboration with the EDGE Students Society, which is a student-run group at the School of Public Health. And we also conduct research as part of the EDGE network, usually based on volunteers from across the network. I think the unique thing about EDGE is that it's really not just for Hopkins folks. This has been a network that has grown globally. You don't have to have a Hopkins affiliation in order to be a part of it. And we've had really successful research collaborations through that EDGE network. And then I think finally our programming is around sharing information and fostering innovation through regular seminars, networking events, and symposiums. We have an annual Global Health Day, which I'll have on a future slide, so you can save the date if you're interested in participating. But many of these seminars in particular emerge based on need. So what are the pressing issues that we want to tackle? So for example, during COVID, we put together a 21 session weekly seminar series to help share the latest findings as they were emerging at the clinical level and at the public health space level. So we're really well poised to help address needs from other centers or pressing needs globally that might need convening in some way and sharing information. And if you have any questions about any of our programs as I'm talking, please do put them in the chat. So, I know that specifically we're focused on what can we do for the DrPH program and for DrPH students. So we definitely offer an opportunity to connect with our global faculty and country office partners. So if you're looking for projects, if you're looking for dissertation committee members and you aren't as familiar with the Hopkins landscape, many of us on the team have been along for a very long time, and we know who we might be able to connect you with, who might be a good player, someone that you'd really have a great time working with, or someone who might be, perhaps a little bit more challenging. And so we can certainly serve as a resource hub for connecting. If you want to do research overseas and you don't yet have a partnership or a site, we're also a great source for being able to identify those and to make some of those connections. And then if you're working at an organization that might be really interested in being a partnership site or interested in having students like yourself or future DrPH students, then we can also connect about that. We do also offer targeted advising around global career pathways. So the EDGE initiative, for example, really emerged around work that was designed to introduce people to non-academic careers. And so we're well poised to historically offer advice around global health career pathways. So I'm certainly not going to prop ourselves up as being excellent for that in the current landscape. We offer opportunities for network building. So I've mentioned the EDGE program a couple of times. Also being able to introduce you to faculty mentoring and faculty research sites and identify global experiences for your practicums, for your dissertation work, and also being able to connect you with our multidisciplinary collaborations across JHU. I think in brief, what I'm trying to say is we can help network you with people, we can offer advice, but very unfortunately, we do not have any funding for global health experiences for DRPH students at this time. So do want to put that out there and say that we're really more of a network and connectivity hub, and also being able to help identify spaces where you might be able to find funding. So as I mentioned, the presentation was going to be quite brief, so I want to open this up to discussion. I'm really interested to hear from all of you what you expect or would want out of a Center for Global Health here at Hopkins. And I would like to say that while I am totally happy to be functioning in the chat, this is a very lonely Zoom space looking at a bunch of black boxes and names. So I would really welcome cameras on, videos on, if that is available to you, whether you're speaking or just participating. As you all know, the Zoom rooms can be a very lonely space. So thank you for all of you who are joining. And I don't know your name, LMB156, so
Oh,
please jump in.
sorry. I just realized my name was up here just incorrectly. Sorry about that. So, just a question on how we can get more information on the EDGE program if we're interested in that. Is that something that we can become involved with, or is that
Yes.
selection for that kind of different?
No, yeah, I'm happy to put a link in the chat here for you to get involved. The first thing that you'll do is join our Slack network. Once you get involved, you'll get our newsletter, and then you can either put out calls for people to engage with on your research around leadership, or you can join our research calls as we put them out. And also, since you brought up EDGE, I'm going to put a plug in for my leadership class, which was largely based on the EDGE initiative as well. So for those of you looking to fulfill your leadership competencies, you can also do that with me. So just give me a moment while I pull that up and then I'll throw everything in the chat.
And while she does that, I can vouch for the leadership class. It was phenomenal. So, if you haven't taken it, it was excellent.
Thank you. All right, what else? What can the Center for Global Health do, or what are your expectations? Yeah, Anita.
Hi, Anna. Thanks for this overview. So I was just wondering about some of those field placement awards you mentioned, especially as we're thinking about our practicums and ideas for our dissertations. Are we eligible for the established field placement and the field research awards?
Unfortunately not. Only full-time students are eligible for our field placement awards.
Thanks.
Yeah, no problem. We also, so I guess I would also add to that, I know that there are times when some of you might at some points in your program become full-time status, and we also can't mess around with that. You have to be in a full-time program in order to be eligible for the established field placement program. But I would say that those, when we post those, either the ones that have been historically posted or the ones that we'll post later this year, so I think it should be end of December, early January, this is an excellent resource to find out who's doing what. The Communications Center at the School of Public Health has their map of projects and programs, and it's outdated so quickly. Faculty have absolutely no incentive to keep this map updated. I'm like looking at some faculty who are here in this call, and I can guarantee you that they haven't updated I would just bet some money they haven't done it. This is a great space to see what is the research that's actually coming forward and being done. And I would just say, reach out to those faculty and ask them if there's space for a doctoral student, or if you just want to pick their brain and have an informational interview, or think about, how your work might be able to align with some of theirs. Yeah, Ted.
Hi, Dr. Kalbarczyk. Thank you so much for this overview. Um, I've got a series of sort of related questions that I would like to invite you to kind of reflect on a bit more, and also the others on the call, really. So the first one is, what's the relationship between the Center for Global Health and the Department of International Health? Uh, the second question is, is there discourse or is there discussion at the center among the faculty in the department about what actually global health actually now means in the Bloomberg School? God knows there's hundreds of faculty in the Bloomberg School who've made their careers on global health or in international health settings. But we are in a moment of profound crisis for global health. I mean, the downturn has affected so many of us directly, myself included. Um, and it's kind of telling that what you said about, faculty research profiles are typically not updated. And it's very difficult for the center to do its convening function because of this. You're probably in contact with individual faculty and individual students constantly, all the time, really trying to make things, make sure that people are updated and make sure that people are connected to one another. But what's the vision that's holding us together as a field here in an institution that has really benefited and is strangely silent? I mean, when we hear things about, you know, America First global health policy, nobody's talking about that, are they? I mean, or are they? Am I listening in the wrong places? I really appreciate this opportunity to ask Dr. Kablarczyk, and I know it's just one instance, but and we may have more discussions about this in other forums, so I don't want to sort of use up all the oxygen in the room, but a little bit on that would be really useful. Thank you. I
Yeah.
really appreciate it.
Yeah, great questions. Throwing me the easy ones, of course. I can start with the relationship between International Health and Center for Global Health. So we've always had a very close relationship with them, but the purpose of the center has largely been to be thinking about global health outside of the School of Public Health. It's really been about how we can bring the institutions within Hopkins together. So we do have on our board of directors, or on our associate directors, the department chair Judd Walson does work with us, and we work very closely with his development team as well in order to think about strategic fundraising that's either department specific or specific to the goals for the Center for Global Health, which for us has largely been around student-centered programming and thinking about global health leadership, particularly with this lens that you're talking about. What does it look like to be leading in global health as we're now moving through this time of turmoil, and as we're thinking about what our own leadership looks like at the school and the people who have built the careers in global health versus now what the global health landscape looks like. So I love your question, and I particularly think about this from a personal view. I think for a long time within global health as a field, we've really struggled with who our most senior leaders are and who the field is. PEPFAR, for example, as we think through our most senior leaders, right? PEPFAR is like the funding instrument that excelled and projected many of their careers forward. And so when you hear tales of how people got $20 million awards or built their career on these like, really giant awards, that advice doesn't trickle down anymore. It's not really relevant to the current landscape, and it hasn't been for most of our careers in this room. And so I think that, that's largely where we've come out of near peer support, like really trying to think about what does global health look like as we're trying to support each other through this, rather than looking to senior leaders to say, well, you reimagine it. Because why would they imagine it? They have largely benefited from the structures and infrastructures that got them into the leadership space. So anyway, that's my personal take on it. I don't think that's the Center for Global Health take on it. What I might also say, Ted, is that Hopkins as an institution is remarkably risk averse. And so when we start talking about having conversations around like what does global health look like, or how do we talk about America first, global health second, or interlayered with it, if you're not seeing those conversations, I think it is because as an institution, which is reflected in the center and all other centers and in the conversations we have publicly, those are conversations that could get people in trouble, and could get people in trouble from a funding perspective. And so people have not been inclined, I think, to put themselves forward to have some of those challenging conversations, particularly when other institutions with whom we have affiliations have been more willing. So for example, Duke, I think, has leadership that has been more willing to have some of those conversations around global health, led by Chris Byer, who used to be one of our associate directors. So I might just say, if you're not seeing it, it's probably because it's not happening publicly. But we're not afraid to promote when other people are talking about it. And I think that is just remarkably reflective of what we are as an institution.
Thank you. Appreciate it. Thank you.
No, thank you. What a great question. I'm like, wasn't expecting that one today. Natasha.
Yeah, I'm wondering, you mentioned that there might be other faculty on the call who are working in the global health space. If they wanted to maybe introduce themselves and talk a little bit about the work that they're doing so that students could maybe put faces to names, and maybe there's students on the call interested in the work that these faculty are doing.
Well, absolutely. And I'm happy to point out, Devakar, I see you first, and you kindly confessed in the chat that I was correct about people not updating their profiles. But if you want to jump on and feel free to talk about your own work, although I imagine many of you in the global health concentration know Dr. Mohan.
Hello. Hi.
Hi.
Lovely to be here. For those of you who may not know me, my name is Devakar Mohan. I'm an associate research professor at the School of Public Health in the Department of International Health. I work primarily in the field of evaluation, implementation research. I teach designs including experimental RCTs, quasi-experimental designs, primarily most of them in aid of implementation research or program evaluation. I started my life as a maternal health researcher, but right now at this point in time, I'm kind of have a finger in many different pies, including nutrition, child health, HIV, and even lab diagnostics to an extent. So it's been great hearing some of the perspectives from all of you, and especially Ted. I feel you. I know I can't fully understand everything that you must be facing out there, but we're all there in support, and please do not hesitate to reach out if you have any questions or any suggestions that you might want to share with us. So having said that, I primarily work, as I said, in the area of program evaluation, and I also co-direct the DrPH concentration in global health policy and evaluation. So at this point in time, most of my work is about program evaluations. A lot of organizations are coming up with a wide variety of reasons to want to evaluate programs. So in a way, there are quite a few grants still available out there that primarily deal with evaluations. And I'm hoping that things improve as in the next few years. It's all of keeping your fingers crossed. Feel free to reach out with any questions, any requirements for any assistance in helping you think through what your needs are in global health as well. Any specific questions at this time? If not, please email me. And my email, I'm just typing in my email, just in case folks want to connect. Yep. Thank you, Anna.
Thank you. Okay, that gave me some time to respond to what's coming up in the chat. Okay, so yes, we have, if you're not following the chat, the Center for, the best way to capture affiliated faculty with the Center for Global Health is to go through the School of Public Health faculty profiles and look for affiliations. Affiliations are mixed, like most faculty can just select that they're affiliated with us if they're doing global health work. There's no checks and balances to that. But of course, you can always reach out to me or our program officer, Megan Harrison, whose email I put in the chat to ask about faculty or ask about expertise and ask outside of the school. There's a lot of background drama between why we're only capturing School of Public Health faculty. Didn't always used to be like that. If you ever want to, have a coffee and hear about database drama, I've got an earful for you, but I won't give it to you here. Renee asked if there is a listserv. We have a weekly newsletter that we put out that really captures global health events, largely also trying to focus on webinars and things that are happening around the world that aren't just JHU specific, because we imagine you're already getting that through the speed read, or if you're part of the Department of International Health and you're on their listservs, you're already getting that. So we really try to focus on jobs, events, and opportunities that are outside of that. Any other questions?
I think one question that's come up has been what types of like practicum opportunities or opportunities for DRPH students might exist with faculty that are working in global health. I'm not sure if you have examples or others as well might have examples.
Yeah, so it's a hard one because Renee's here, so I feel like I can't say all of the things I might normally say in a closed, if it was just us all one-on-one, because now I might say something wrong. But, my sense is that practicums are best poised when they're, within your workplace, and you're able to like build on something that is, not something that's in your normal scope of work. If you want to stretch yourself, frankly, I mean, faculty have a million project ideas. They just don't always know how to condense it into something that is ideal for you. So we've always got a million things going on. And if you come to faculty and say, I see that you've got this project on XYZ, I'd be really interested in doing something. If you can propose what that something is or be in a brainstorming session with them about what that something is, then it can be pretty easy to especially generate what a practicum opportunity might look like. The Department of International Health in particular has just done some strategic prioritizing around key areas for women's health, health systems, working on something around implementation science. Devakar, you might remember what the other strategic groups are as well, but within those, right, there's strategic documents, lists of faculty who are working on these issues, what those focus areas are and what the areas of growth are. And this would be a great place to sort of dive in and see where your work might be able to align with some of that and then pair up with faculty. Yeah, okay. I mean, I think you're exactly right. So most of you are attending virtually, difficult to know what projects instructors have going on. There are a couple of ways to find out. One, like I said, when we post our field placements each year, this is like one of the best ways to snapshot what kind of work is being done. And you might not be eligible for the field placements, and it might be really frustrating to look through a list of projects that you're not eligible for funding for. But at the same time, now you have a snapshot of what funding is coming through, what projects are happening, and how it might align with your work and your interests. So that is one of the best ways. The other thing is to be talking to your advisors or to some of the concentration directors about what kind of funding is coming through and what people are working on. Especially if you're like a year out from wanting your project, that's a great time if someone's just getting funding to be thinking about what kind of project you might want to do and how it might fit. But honestly, I think the best thing that you can do is be proactive and either asking us for me and Megan for faculty names and then talking to those faculty directly. Because many of us might not have funding, but we do know someone who does, or we know someone who's working on that issue and we can connect you. So it's a time to be bold and just ask the questions. Which can feel frustrating, I know, when you are remote and you don't know people as well, but this is a really great opportunity to do that. What concerns do you have about like working in global health or your practicums or your dissertations or anything like that? What is coming up as a source of anxiety for you that you wish or you would hope that a Center for Global Health might be able to help you with? Or if you just want to share anxieties in general, so you could do that too.
You talked about how the center doesn't have funding to support like dissertation or practicum work, but would faculty or people working within the center be able to help us identify external funding or help us think through if we're doing a global dissertation? Is that
Yeah.
something we could problem solve with?
Absolutely. So, there are a couple of ways that you can be thinking about your dissertation work with faculty. And you can join a faculty's project. And there are a couple of things you can do. You could either, as a student, receive funding to be working on that project, right? An hourly wage, depending on where you are. But the other thing is that you can also get or negotiate for tuition remission during that time period to be able to work on that project. And they can be covering either classes that you're taking that are related to that, or they can be covering your dissertation credits. So you can be talking to faculty directly about embedding into their projects. Now, this doesn't work if you want to do Natasha's project, over here that's like related to what I'm doing, but isn't embedded in the work, like it's not serving my outputs or my objectives. But if you are working on a faculty's grant and you are able to sort of embed your work into something that meets their needs, but also meets your dissertation needs, you can talk to them about funding. It's not, like we know money is a sensitive topic, but whatever, at this point, like we're very used to having these conversations. What money is available? Do we have money to like for travel, for example? Maybe we can't give you hourly wage, or maybe we can't do tuition remission, but we have a huge travel budget and we could support travel. You just have to ask what's available. What else? Any other questions?
I'd maybe ask a question to all of the DRPH students on the call. How can we, as DRPH students interested in global health or working in global health, better connect together? What should that look like? Should we be better connected? I think some people are in the global health concentration, but several of us are not. But we're working in a global capacity. So how might we stay better connected so that we know each other, what we're working on and how we might be able to network in that capacity as well.
Well, I think a DRPH student group would be a really cool thing for a couple of reasons. And I think the Center for Global Health would be interested in helping to facilitate something like that. In particular, because you are all professionals, like you are global health professionals. You are like people in this field with a wealth of experience who clearly need to be talking to each other, and also exploring these big issues. I think I put in the chat earlier the questions that Ted raised. Like this would be a remarkable experience for a student-led seminar series that the Center for Global Health can help to organize, help to find speakers, help to facilitate and promote, where we're then having these conversations that are critical for your stage of career and where you are. So this is a great example. Come to us and say, like, we want to do this. Can you help us? Can we, be a part of this? And I think if there was some form of DRPH group that came in that kind of capacity, then we could create something more regular, like a regular series that we were able to do or be responsive to. So thanks, Natasha. I just want to say, like, I think that's such a great idea, organizing and coming together in a way that, then you can help work with the Center for Global Health to meet your needs would be really important. I'm seeing some comments from Lisa, particularly around like joining projects and knowing interests and like, talking to a faculty member and saying, my interests are XYZ. And I think what I'm trying to say is if you have interests, you should be emailing me, you should be emailing Megan, and you should be giving us specifics so that we can connect you with people. The other thing is that, like, I deeply believe in friend of a friend. Like, it is very unlikely you are going to come to me and your interests will be my interests. But I promise you, I can connect you to at least one person who's going to have some shared interest, who can then connect you onward to help you find the right best match. So the biggest work you have to do, the biggest hurdle, is putting yourself out there that first time. Right? Come to us, let us know what your interests are, because if you don't tell us, we can't know. And if we're not posting out what they are, then you also can't know. So I wouldn't rely on databases or information that's there. I would really just rely on conversations. Okay, and so speaking of, I see there's questions from Colleen around advice and etiquette or tips. Sure, I can give you a couple. I would say please make your email short. I know you all have received like novellas from someone that you just don't read. Just give me the quick hits. Like here's what I'm looking for. I'm really interested in finding dissertation advisors who work on maternal and child health. My background is in sub-Saharan Africa. I'm really interested in menopause and older women's health. Boom, 3 bullet points. And then I can very quickly point you in the right direction, or I'm the right direction. We are connectors. I would say if you don't hear from me in a week, email me again, right? I think the same kind of stuff that you would have heard at the advising early sessions with DRPH is like, if you don't hear from people, just ping them again. That emails get lost. Sometimes we mean to get back to you when we forget, and just go in on it. I think like Natasha's posting here, send like people in your circle already are very happy to send an email on your behalf. I'm now a part of your network. I'm one of those people. Devakar, the other concentration directors, ask your advisor for help. If your advisor is not in your field of interest or is not directly associated with what you want to do, that's fine. They don't need to be, but they can help to connect you with people who are. And they're an excellent resource for that. So if they're not meeting the need in some other way, they are fundamentally there to help connect you. Nabila.
Hi, Anna. I'm sorry. Sorry about that. Um, I wanted to ask about students who are not directly in the global health concentration or international health, related degree programs.
Mm-hmm.
Sorry. And then just to understand what we can do to connect better with people who are in the faculty or who are doing projects. Like this session has been really helpful because it's, providing all that information in one place. But I have personally found it a bit challenging to, reach out. There's so much that's going on, but it's just been a bit difficult to do that. Thank you.
Yeah. Sorry, what is the core of your question?
So Okay, yeah, right. So it's for individuals, for students who are not directly in the global health
Oh,
or
not in the
international health.
concentration.
Yeah, so what can we do to increase our chances or exposure? Like, if there are formal webinars, seminars, class, what can we do? Classes are difficult because we are paying out of our pockets. So like what can we do? Yeah. Thanks.
Yeah. Okay. So first of all, I mean, I want to recognize like we've got folks here in health equity and social justice and folks in implementation science. I am implementation science graduate myself. There were a number of us doing global health pieces there. So I would like, again, highly recommend if someone feels particularly passionate about this, I think having some kind of global health student group would be an excellent resource. I think staying in touch with the Hopkins Center for Global Health, subscribing to the newsletter link that I put in the chat, or if you're interested in our leadership lens, it's an or you can also be a part of the EDGE network and stay in touch there. I think these are the best things that you can do outside of being in the global health concentration.
Thanks, Anna.
Yeah.
And I would say if you want to find a connection to your concentration, but have a presence in global health, talk to your advisors and then reach out to us, some of us as well. We can also try to see if there are ways in which we could work together. For example, Nabila, uh, whatever you want to do in environmental health and you want to do it in the global health setting, we have faculty who can probably work with you for anything that you have of interest. Like, say, for example, you might say air pollution, climate change, all those different things. We have somebody or the other who's an expert in it, and we can make those connections for you.
Thank you so much, Diwakar. I'll follow up on that. Thank you.
And then okay, so here's maybe a couple of things I would plug for a student group. If we do, if that were to be something that emerges, obviously Center for Global Health is very open to working with student groups like we've done with EDGE. And what that also means for us is that we're able to not only promote the types of events that you'd like, facilitate networking, maybe even particularly when you might be in person during institute events or during orientation, but it also then allows us to help find funding that might be relevant to the specific student group as well. And so if that's an area of interest where people would like to grow this throughout their program, please do reach out to me. We would be really, really happy to try to facilitate that and maybe get some guidance as well from Katie in the DRPH office about what that looks like logistically for student groups that are specific to the DRPH program.
I can certainly set up a DRPH Global Health WhatsApp group to start at least.
That would be so great.
And Nabila, I know you are as well. I just saw your message come through.
Yeah, and I wonder, I mean, I am picking up, so what I would say is that the Center for Global Health, I think, has for a long time tried to capture all of the information about what's going on in global health across the school. We've faced a number of logistics barriers and hurdles to be able to do that. And so what we've been able to really foster instead is just a vast network and being able to really find you, faculty, us, friends of friends. So please really leverage those people who are already in your circle, your concentration directors, your advisor, myself, in order to help you. Because we're always happy to send an email on your behalf, help you to connect, overcome some of those hurdles where you might be feeling a little bit anxious or just overwhelmed or not feeling like you're getting a response and you want a little bit of something to help grease the wheels. All right, any other questions? I do want to just put up two quick slides because I see that people are hopping off. This year, the Consortium of so the Center for Global Health is a member of the Consortium of Universities for Global Health, and their annual meeting is held this year in Washington, D.C. And it will be April 9th through the 12th. And we always have a very large presence there. So if you're going to be there, or if you had an abstract or a poster submitted, we will have registration scholarships available for those people who had abstracts that were accepted, and we'll also be there and try to have networking events and opportunities while we're there. This is a great space to really connect. And if you're in the DC area, then it's not far from you. So if you're going to be there, let us know so that we can find you and help to facilitate those networking opportunities. We will also have our annual Global Health Day event will be on April 21st at the School of Public Health in Finestone Hall. And what we have historically done is had a major keynote speaker come and talk, and then we have a series of student poster presentations. So students who received funding from us then present about their work. What we are moving towards now is having more alumni panels where people at various stages of their career talk about global health experiences, how they shaped their career, and what they're working on and their vision for global health moving forward. We still have the student poster presentations, but this is also a great opportunity to network with faculty and students across JHU. So just wanted to flag those two events, the one in the 9th through 12th, and then the one on April 21st.
I really appreciate your time, Anna. I think that people are grateful to learn more about the center. And I anticipate your inbox having some extra emails in the coming
I
days.
hope so.
Yeah.
Email me.
Yeah, and I will certainly follow up and get at least a WhatsApp group started for those who are interested in global health among the DrPH students, and then follow up with you as well about next steps for a student group if we have enough interest in that.
That would be great. Thank you, Natasha.
Wonderful. Thank you all for coming. If there's no other questions, I'll end the meeting.
Great, lovely to